Hey everyone, welcome back to Real Talk Pelvic Health. Today we're going to talk about hip strengthening. People with pelvic floor issues, especially pelvic floor overtension, often tend to have weak hips. Postpartum is a time when this is really prevalent. So some moms will say that when they go on long walks or if they do a lot of standing, that they feel heaviness in their pelvic floor or pelvic floor pain. And often doing some hip and core strengthening kind of offloads the tension in the pelvic floor and it puts it in the bigger muscles that surround the pelvis that are intended for that type of support. So we're going to go through some of those exercises today. I have a physio ball here or an exercise ball. If you have one of those at home, that's ideal. If not, you can also put your feet on a couch or an ottoman. You can also use the wall. Anything that's that height. There's one exercise you won't be able to do if you don't have a ball, and that's fine. You can just skip over that one. So, this is great for basically like glute and outer hip strengthening. So even if you're not a new mom and you just have weak hips, these are some good exercises to try at home. So let's do it. Okay, so I have my ball here. The first one that we're going to do is bridging. Okay, so with your feet up on the ball, we're going to first roll your pelvis back to flatten your low back into the floor. Okay, from there, you're going to lift your bottom up and down. And with this, I'm squeezing from my glutes to lift up and down. Okay, so let's warm up with 10 or 20 of these, just getting some nice glute squeezing at the top. If you feel this in your low back, you're probably not rolling your hips back enough. Okay, so some people, when they do a bridge, they kind of arch from your back, but you need to tuck your butt. You can't let that back be arched. The butt needs to be tucked. Okay, so once you feel like the back of your legs and your glutes are getting a little bit warm, then we're going to go into what's called a hamstring curl. So this is the one that if you don't have a ball, you won't be able to do at home, but you can just skip over this one and wait for the next one. So for the hamstring curl, again, we roll our back flat into the mat, so the pelvis is rolling back this way. Okay, you're going to lift up your butt, and then you're going to roll that ball in and out. So this one you're going to feel in your hamstrings, which is right here. Okay, I usually have people do a set of 5. This one tends to be really hard if you haven't done these before. So 5 is a lot. Usually people will do 4 sets of 5 is kind of where I have people start at home. Okay, so from there, we're going to go back into a straight leg bridge, but we're going to practice raising one leg at a time. So the goal of this one is to have your glutes on your stabilizing side, keep your pelvis level. Okay, so it's glutes and really obliques or abs from the opposite side that's going to keep your hips level. So it looks like this with your feet on the ball, hips roll back, you're going to lift your bottom, and then let's say I'm going to raise my right leg. I will squeeze my left glutes first, and then look at my hips and make sure they stay level as I raise my right leg. Okay, I set it down, then I squeeze my right glute and lift my left leg. Okay, so why don't you try 10 leg raises? Don't let that butt drop down here. Don't let your hips tip or twist, and then keep that pelvis roll back. Okay, so 10 leg raises. Go ahead and try that. For this one, as far as reps and sets, I typically have people do 10 leg raises, and I have them do 3 sets. Okay, from there, we move into a bridge, a bent knee bridge or a shoulder bridge. Okay, so your heels are going to be on the ball or the wall or your ottoman, and you're going to think about pulling the heels down into the ball, pretending like you're going to scrape mud off the bottom of your foot. Okay, and that's going to activate here. If you're pushing out like this, if you're kind of pushing the ball that way as you bridge up, you're actually going to use more of your quads. So you want to be pulling that ball towards you as you bridge up. So, as always, My pelvis rolls back to flatten my back into the floor. And then from there, I'm going to lift all the way up until the weight's on my shoulders. Okay? So we're lifting up and down just like this. And I'm going to feel this in my glutes. If you don't get all the way up, let's say you're getting to here, you're going to feel it more in the hamstrings and less in the glutes. You want to get all the way up to those shoulders in order to activate the glutes. Okay? You can see I'm kind of wobbling around a little bit. If that's too much wobbling for you, if you're not stable enough, go ahead and put the ball up against a wall so that it keeps it stable. Or just put your feet on the wall in this position to do it. Okay, so I usually have people do 20 bridges and 2 sets of that exercise. Okay, to make it harder, if you want to, you can do a single leg bridge. Okay, so I just crossed my left foot over my right knee. Again, pelvis rolls back as usual. I lift all the way up and come back down. Okay, and this one's harder because it's one leg at a time. So I tend to have people do 20 on each leg, 2 sets if they're able. 1 set may be enough. All right, and then lastly, we're going to work on hip abduction. So those muscles are your outer hips. Okay, so for this one, you're going to lay on your side. You're going to roll your hips forward, and then your top leg is going to go back behind you. Okay, from here, we're going to raise our leg up and down. So there's a lot of compensations that people will make with this one. The most common is the leg really coming forward. They go for height, and they actually end up working the front of the hip instead of the back of the hip or the butt. So on this one, make sure that leg is staying back behind you and it's not coming forward. The other compensation that people will make is they start rolling the pelvis back. So as the leg comes up, the pelvis rolls back. Okay. Again, you're going to get the hip flexor. You're not going to get glutes back here. So for this one, I typically have people do 30 lifts on each leg, and I have them do 2 sets. Okay. There's a really popular exercise called clamshells like this. I don't often have people do that one, especially if they have sacroiliac joint pain, because I just find that it often irritates the sacroiliac joint. I know a lot of therapists do it and a lot of patients do it. It's just not my personal preference. I kind of like to stick to this one. Okay. From there, if you've done 30 reps on each side, 2 sets, then you can go into a side plank. Okay. So this is actually going to work the outer hip on your bottom side. Okay. So if I get in my side plank like this, I'm kind of arching my hips up towards the ceiling. Hand on the hip, or hand can also be on the floor. But from here, you're going to raise that top leg up and down. So remember, this is more about the bottom hip stabilizing, keeping your weight off the ground, than it is about working the top leg. So I don't care as much about the angle of this hip as I do about this leg staying up. Okay, to make it harder, you can straighten your leg and raise up and down. Okay, and then this one's harder. So I tend to have people do 10 reps of that one and 2 to 3 sets on each side. So hopefully those are some fun exercises that you guys can try while you're stuck at home with this COVID virus. Feel free to ask any questions, and hopefully you feel a nice workout in your hips and feel it offload your pelvic floor a little bit. Have fun. See you later.